Welcome back, everyone. We hope you've had a lovely lunch and found the morning interesting so far, and maybe you've hopped into a lunchtime session. So I'm Vicky Harris. I'm the Head of Learning at the RCSLT, and I'm chairing this keynote section of lightning talks. These will be led by colleagues from the professional development team and the policy and public affairs teams at the RCSLT. So we will be having 4 different talks. I will be joined by my colleague Mark Singleton, the Learning and Development Manager from the RCSLT, in a moment, and we're going to be talking about the RCSLT Professional Development Framework. And then we will be followed by Alison Ramsey, our SEND Development Officer, who'll be talking about SENS. Then we move on to outcome measures with Catherine Moyse, our Outcomes and Informatics Manager. And finally, we will be joined by Berenice, our Strategic Workforce Advisor on health inequalities. So it's going to be a really interesting and quick lightning session. Okay, so first of all, to Mark and myself on professional development, on the framework. Okay, if you could move the slide, please, Mark. Thank you. So what is the Professional Development Framework? Well, obviously, it is a framework. It's for your professional development. That much is obvious. It was developed by members over a year, in which we had 5 online events at different times of the day, which were very well attended by members. And we had a working group that worked over the summer of 2022. Again, a large online group that worked on developing iterations of this. And then we had a consultation, which was open to all members. So we've had a really good engagement in creating this, and we feel it's very much for the profession, by the profession. And thank you to those of you who did help with designing it. So it came out in March, and we're very busy trying to make sure that everyone is aware of its existence and that you're able to find ways of using it. It basically is a structure for you to map your skills and your knowledge, so where you are at now, and it allows you to think about the future, so where you would like to be in terms of what professional development you need, what kind of specialisms you want to go into, what kind of general areas do you want to expand into. And it really is a tool to be used in the space between, you've got your sort of AHP or whole workforce frameworks that maybe come from your nation governments and bigger organisations like NES and NHSE and so forth, and also those clinical competency frameworks that are very specific to what you might do. This is the tool that you can drop in and out of to think about your career as an SLT. And it is designed to be irrespective of your setting or your level. Members who were involved in the process really wanted it to be a circle shape because they wanted you to avoid anything that looked hierarchical. So this is very sort of an inclusive shape. So that is a very deliberate plan there. Around the middle is the sort of 5 core areas that we want members to reflect on. And these in the framework, they have reflective questions for you to think about on your own or in your team. Looking at impact, the impact you have as an SLT and your service, inclusion and diversity, sustainability, co-production, and practitioner well-being. And probably these are lots of themes that are coming out of the conference. If you haven't seen them already today, they will be with you very soon over the next couple of days. And then around the outside of the circle, we've got domains of practice, and these broadly relate to the 4 pillars of practice. So we've got facilitation of learning, evidence, research and innovation, leadership and management, and professional practice. And those then split down into more detailed areas of which you can mark yourself against where you are now, and then think about where you might want to be. Okay, and I just should say, I've got a copy on my desk. It's a document. I keep it to hand because it's really very useful. Okay, if I can have the next slide, please, Mark. Okay, I think this one is over to you, isn't it? Thank you.
Yeah, thank you, Vicky. So in terms of who the framework is for, it is, as Vicky mentioned, it is profession specific. So it's really designed for speech and language therapists. And we sort of see it as being relevant kind of from post-qualification onwards, for as much or as little as you'd like as an individual user of the framework. It wasn't necessarily specifically designed for students and NQPs, largely because they already have existing frameworks and structures in place, and we didn't necessarily think they needed yet another one. But that doesn't mean it's not of interest to students and NQPs and relevant. It's a sort of thing that can be used, towards the end of the degree and into first kind of NQP post around considering overall career ambitions, career aims, kind of starting to consider where you'd like to head, and then from there starting to consider what do I need to work on in order to get there. It's also of interest to those working with speech and language therapists, but potentially not SLTs themselves. For example, people working in commissioning roles, people who work alongside speech and language therapists. Like I said, it's a profession-specific resource, so it wouldn't be for them to actively work through, but it could be useful in terms of understanding or developing an understanding of the SLT role, and where that fits in around, within an MDT. In terms of what you can use it for, we've really tried to leave this as open as possible. We don't want to be prescriptive here. We want this to be a framework that works for you, for what you need from it at that moment in time. So there's a list there. It's by no means an exhaustive list. We don't want to be prescriptive, but we can see it being used for things like appraisals and performance reviews, career coaching, if you're looking at developing more of a portfolio career. But like I said, it's not, we're trying not to be prescriptive with it. So within reason, anything is fair game, frankly. Excitingly, we're also launching an interactive version that will be coming out within the next few weeks. So do keep an eye out for that. Obviously, when we launch the interactive version, we'll let people know via the e-newsletter, and also via kind of social media channels as well. In terms of access, I'll leave this slide up for a while because there's the URL and a QR code there. It is very easily accessible via our website. You also don't need to be logged in to access it. Because we see it being useful to those outside of the profession, we wanted it to be accessible to all. So you can see there, once you're on the website, under the learning and your career section, it's one of the main headings from there. But like I said, there's also that URL at the bottom and a QR code. And I believe at this stage I'm handing back to Vicky.
Thank you, Mark. Yeah, so just to let you know, we are working on making sure that people are aware of this at the moment, and then probably next year we'll be looking at running evaluation events, so keep an eye out for that. And we're also going to be trying to tie in new resources to elements of the framework, so you can see new resources of where they hit on the framework. So that, just to be aware. If you can have the next slide, please, Mark. Thank you. And very quickly, we're thinking about some leadership development opportunities for members, and we could use your input even. So if you could start thinking about these questions that are on the screen: what does leadership mean to you? What are the areas for development? What does good look like in a leader? And what's the difference between leadership versus management training? If you could start having a think, we will be surveying members in the sort of next few months, so look out for those, please. Thank you very much, and over to Alison now.
Hi, I'm Alison Ramsey. I'm a paediatric speech and language therapist with 12 years experience. I'm a SEN secretary, and I'm currently working for the RCSLT on an 18-month SEN development project. So what is a SEN? I was tempted to throw in some colourful semantics, what doing what, like colour coding here for my fellow paediatric therapists, but I resisted and stayed on brand with our RCSLT blues. So what is a SEN? It's a clinical excellence network, a group led by members for members. And those SENs that register with us are eligible for support from the RCSLT, for example, access to resources. So SENS were formerly known as special interest groups, and you may see that some other AHP organisations still use that term. SENS are primarily for speech and language therapists, including SLT assistants and SLT students, but many also welcome other professionals with whom they may work, such as nurses, OTs and SENCOs, etc. What do they do? Most of us who are familiar with SENS probably immediately think of study days with visiting speakers, and SENS are focused on continuing professional development for their members. This usually would include study days running a couple of times a year, or shorter, more frequent events. However, as organised professional groups, SENS also offer opportunities to be involved in CPD in broader ways, such as networking, research, influencing and campaigning. And what are they like? Well, SENS that register with the RCSLT should be reflective of RCSLT values. They're supportive, inclusive and welcoming groups of our professional peers. They're diverse in their format, in their focus, and we're working to ensure that their membership and leadership is also representative in our profession as we strive to become increasingly diverse. SENS are focused on delivering CPD that is driven by the evidence-based base and that develops the evidence base. In terms of geographical coverage, we currently have 138 SENS registered with us and listed on the RCSLT website. You can see from the figures here that we have 7 in Scotland, 7 in Northern Ireland, 9 in Wales, 68 in England, and 47 that operate nationally across the UK, meaning that in any of the nations, members have access to a minimum of 54 SENS covering a range of clinical areas. This is constantly evolving though, according to member wants and needs. For example, in October alone, we've had 4 new SENS register with us. If you don't see the SEN that you need, why not consider speaking to the RCSLT for advice about how to set one up? Here we have the clinical areas covered by the SENS, and the number of groups in each clinical area is reflected in the font size on this slide. So you can see that our largest concentration of groups are in the areas of children and young people with 19 SENS and dysphagia with 16. We have 10 SENS covering autism, 9 for deafness, and 8 for learning disabilities. You can see that there's a broad range of clinical areas covered though, with those with fewer groups such as palliative care or cleft palate being no less important. How does SENS benefit you? So my colleague Mark has just spoken to you, sorry, and Vicky, I won't forget you. My colleagues Mark and Vicky have just spoken to you about the professional development framework. And I wanted to briefly highlight that when you're a member of a SEN, it doesn't only relate to the learning element of that framework. So on this slide, I've included an example of an outcome from each part of the framework to show how being an active part of a SEN might support wider professional development. For example, in the professional practice section, there's an outcome that is know, adhere and contribute to the development and implementation of local, regional and national policies, statements, guidance and governance frameworks. And it's likely that discussions at study days will be contextualised by these policies, statements, guidance and frameworks. And it's possible that as a pool of clinical excellence, SENS may even be called upon to contribute to these. So if any SEN-related learning in this area could be reflected in the PD framework, this outcome would be a good place to put that. I encourage you to read through the framework and consider how your learning with the SENS might apply in any of the 4 areas. I've included a link at the bottom of the slide as well to the HCPC guidelines about CPD, which also makes clear how membership of a SEN can help you to fulfil their requirements. How is the RCSLT working with SENS? So if SENS register with the RCSLT, they can access various guidance, resources and support. The RCSLT recognised some time ago that the offer needed to be improved, and so the SEN development project was devised, seeking to work with members over an 18-month period to ensure that we can provide what SENS want and need in order to allow them to focus on delivering cutting-edge CPD. Feedback from a listening exercise showed that we need to focus on 5 areas for support: governance, committee recruitment and retention, web content, communication platforms, and facilitating networks. You might note that equality, diversity and inclusion is not explicitly mentioned, but that's because development in this area is to be threaded throughout the project to make sure that it's intrinsic. If you'd like to find further information about SENS, you can see a link on your membership dashboard. The button on this slide is highlighted in the red box, or you can use the link at the top of the slide to go directly there. But please do check back regularly over the next 6 to 8 months, as there'll be lots of updates made to the content and resources available as the SEN development project proceeds. And if you've got any queries or suggestions about the SENS, then please email me at sen@rcslt.org. Thank you for listening, and it's over to my colleague, Catherine.
Thank you so much, Alison. Good afternoon, everybody. My name is Catherine Royes, and I'm the Outcomes and Informatics Manager here at the RCSLT. I'm here today to talk to you all about the RCSLT Online Outcome Tool. Next slide, please. Now, I'm sure many of you will have noticed that in the last 12 to 18 months, there have been countless strategies, articles, opinion pieces, and news stories published about the importance of data in healthcare. Many of these publications talk about measuring the quality of our services and measuring outcomes, and reference the importance of data in identifying and addressing health inequalities. Next slide, please. But no matter where we're working, and whether or not these publications apply to us in our individual work settings, as HCPC registered professionals, we need to ensure that we're assuring the quality of our practice. Next slide, please. As highlighted by the HCPC standards, a key part of that involves taking an evidence-based approach to practice and using data, especially outcome measures, to shape the way that we deliver care. Next slide. So because of all of this, evidence-based practice and outcome measurement are key areas of focus in the RCSLT strategic vision, and one of the aspirations from the vision is set out on the screen in front of you. Furthermore, the professional development framework that Mark and Vicky have been speaking about has a section dedicated to all things evidence, research, and innovation, which encompasses quality improvement and outcome measurement, in recognition of the importance of these areas of practice. So, what does the RCSLT provide to help you with your professional development in these areas? Next slide, please. The short answer is there is a lot that we have on offer for you. There is a wealth of resources available for you on the RCSLT website, including guidance, frameworks, tools, and case studies. I've highlighted some of the key items on this slide, and my colleagues are going to post some of the links to these resources in the chat so that you can find them easily through the website. Next slide, please. For the remainder of the presentation, I'm going to be talking specifically about the route, which is one of our key tools that the RCSLT provides to help you with getting a handle on your data and using it to deliver data-driven services. For those of you who aren't familiar with the route, it supports speech and language therapists to collect information about individuals accessing speech and language therapy services, including their outcomes using therapy outcome measures. By submitting your data to the route, your service will be able to access reports and analytics on your data. Next slide, please. So what does the uptake of the route look like across the UK? Well, as it currently stands, we have speech and language therapists from 83 organisations using the route. This includes SLTs working in independent practice, in the NHS, local authorities, and in the third sector. And these sites are marked on the map in red. The blue dots on the map represent the 100 organisations that have signed up to use the route and who are working towards implementing it. Collectively, these services, some of which have been using the route since 2016, have contributed data for 81,000 completed episodes of speech and language therapy, which is just a fantastic achievement by our profession. Next slide, please. But what does this all mean in real terms? You might be wondering what the route actually does. In a nutshell, the route transforms the data you gather into information, which in turn is a valuable source of intelligence. And by this, I mean intelligence for us individually as clinicians, but also for the managers and leaders of services, and more broadly, for us as a profession collectively. Next slide, please. The route does this by generating reports about the data submitted and displaying this information in a variety of different formats, as you can see on the screen here. For instance, at a glance, you can see change over time in association with speech and language therapy for individual service users and groups of service users. The route also produces charts showing a breakdown of who is receiving therapy in your service, for instance, in terms of age, gender, speech and language therapy needs, etc., and how many of these individuals are improving in association with intervention. All of this can assist with monitoring the quality of care we provide and contribute to the continual improvement of our services. Next slide, please. On top of this, there are other ways that the information gathered via the route can be utilised, as set out here on this slide, which summarises the insights shared by RCSLT members who are using the route. As you can see, people are finding it a useful tool to support their reflective practice, to identify opportunities to improve elements of their service, to support business cases, and to communicate the value and the impact of speech and language therapy, but to name but a few applications. Next slide, please. Now, one of the things I want to highlight is that we don't just provide you with the platform. The team here at RCSLT are here to support you in everything from getting ready to start using the tool, through to interpreting the reports and using the findings to shape your practice. We're here to answer your queries and questions, help you navigate the requirements with respect to information governance and IT, signpost you to useful resources and training materials, and provide technical support. Next slide, please. If you're interested in finding out more, there are some suggested next steps on the screen here. And again, I think colleagues are going to put those into the chat. You can, of course, also reach out to me through the conference platform over the next couple of days, or come along to one of the lunchtime drop-in sessions. We have one with the Research and Outcomes team tomorrow at 1:30. So it'd be great to see you, meet you, and hear all your questions. Thank you ever so much for listening. I'm now going to hand over to Berenice.
Hello, everybody. My name is Berenice Napier. I'm the Strategic Workforce Advisor at RCSLT, and I'm going to talk about health inequalities. Next slide, please. So there's been so much written about the need to address health inequalities over the last few years, and this talk is to share with you some SLT-specific practical resources that you could take to your service tomorrow. They'll give you a place to start in working out the degree of health inequalities in your area, pointers about what to think about, and adjustments to services that you could make. At a time when waiting lists are huge, you might consider whether your service should be looking for people who've not so far come forward to be seen. But this is about acknowledging that SLT has a part to play in addressing inequalities in society. It's not about adding to your caseloads. You know, those children or adults with unmet needs will eventually be in the system at a later point. You know, their needs all the greater for the delay. Next slide, please. So firstly, this is an overview of the RCSLT's resources. My colleagues will be putting some links in the chat to them. So the guidance gives some background and signposting to further reading and research, but it also covers what addressing health inequalities looks like from an SLT perspective. The people that appear on your caseload may not be representative of unmet need in your service. So the self-audit tool and the indicator sheet can help you decide where to look for that unmet need. The case studies show practical applications of addressing health inequalities, and we're always on the lookout for new case studies. So please let us know if you have one and you'd like to share it. Next slide, please. So turning now to the audit tool. It has a series of reflective questions with space to note actions and resources. You can also use a rating if you'd like to, but it's there to adapt to your own needs, and it's downloadable in Word, so you can just change it to meet your needs. We'd encourage you to use it in the context of your team environment, perhaps in clinical excellence networks, and perhaps it's an activity that you could suggest to students on placement. Some services are completing an audit annually, and ideally you'd repeat that so you can monitor your progress and trends over time. So it could also help you in making a compelling business case for addressing health inequalities in your services. So use it in a way that works for you or your service, you know, amend it and let us have feedback. Thank you. Next slide. So with thanks to our former colleague, Katie Chad, who developed this indicator tool, it guides you through collecting and recording data with respect to your local population and then comparing that with data from your service. So we've included suggestions of some of the kinds of information that you might want to record. So for example, we know that broadly there are health inequalities related to ethnicity, gender, the use and proficiency of English language. So we've included rows for these. But select the data and information that seems most relevant for you and your service, and use the blank rows to record other information that's helpful. As the purpose of the worksheet is to compare two sets of data, we recommend you collect and record the same type of information if you can. Might not always be possible though, so you might need to compare slightly different types of information or use proxies. But remember, if you're doing this, then you need to be really cautious of any conclusions that you draw, as you wouldn't be strictly comparing like with like. So also remember that in your service, you'll not see the total population with a specific clinical need in 1 year. We'd really be interested to know if anyone's working on how to compare an annual caseload with perhaps a total expected population need. Please get in touch if you're doing any work like that. Next slide, please. Could I have the next slide, please? Oh, thank you. So lastly, you might ask, where will you find the population data to support your analysis? And there isn't one right way. You might need to pick and choose data sources depending on what you're looking for. There are a few noted in this slide. I would just highlight, though, that the Office for National Statistics has launched lots of new products this year with the new census data. So the image that I'm showing, that's showing on the right of the slide here, was created in a custom dataset tool. And I created this in 15 minutes. But there's lots of categories that you can pick up and use in a specific area on this tool. You can also have a look at the resources section within the RCSLT's website. So thank you. So what can you do? Here are a few suggestions to get you started. If you've got half an hour to spare, perhaps create a custom data set on the Office for National Statistics tool. Perhaps share at your next team meeting what you've learned today, talk about some of the reflected questions, or perhaps consider whether you should do a full audit. Think about asking students on placements if they can help in some way. Or SENS, could you help with updating incidence and prevalence to include EDI data in your clinical area? So above all, perhaps you could use the information to drive your plans to address health inequalities. We really love to hear what you do with these resources, and hopefully you can share with others what you're doing too. So next slide, please. And so lastly, these are the links to the resources. We had a webinar and a podcast, which have all talked about health inequalities. Thank you. I'll hand back to Vicky.
Thank you, Berenice, and thank you, colleagues, for these really interesting and short and sharp updates on the work you're all focusing on. So now we'll head into another break for 20 minutes. So do use this opportunity to see who has registered at this year's conference under the attendee tab and create some conversations. And after the break, we'll kick off with our final 6 parallel sessions for the day from 3:10 to 4:10. And again, just to note, any sessions you weren't able to attend, you can access at a later date. Thank you very much.